You know, let us start with again the carcinoma of the cervix, which is a very commonest malignancy in females because of the early marriages and number of children, and also because of the various infections. So, these people, particularly the early marriages and more number of children and sexual activity with the men, particularly many partners, and also without circumcision can predispose to carcinoma of the cervix. So, how it starts is actually there is a prolonged gap between the invasive carcinoma of the cervix and its early stages. So, these can be diagnosed by doing what is known as the Papa-Nicolau smear. So, who are the people who require these Papa-Nicolau smears? The women, say after the childbirth, and say from the age of 18 years to 60 or 70 years also may require to have the Papa-Nicolau smears. So, usually women, they don't bother if there is no white discharge, no red discharge, or is no complaint, they don't go and consult a doctor. But why we advise women to go to the doctor after the childbirth for a gynecological checkup, particularly for precancerous cases of the carcinoma of the cervix, is to detect them at the early stage to give a proper treatment. What it requires is a good gynecological examination, and particularly if they complain of itching or white discharge, or after having intercourse they may have complaints of red and white discharge. So these people should immediately consult the gynecologist, and a gynecologist will have a look at the cervix by means of a speculum, and she will decide whether the cervix is normal or if there is anything abnormal like erosion, some sort of an ulceration of the cervix, or anything abnormal can be growth, or any new growth can be identified. So, a very simple procedure. Only thing is the patient should be reassured that this is not a big procedure. All women should be screened for this unwanted cancer of the cervix. So, what they have to do is there will be a spatula. This is called as the air spatula, which goes into the endocervix and collects cells from the endocervix, and there is a junction between the cervix and the endocervix and the ectocervix. So cells also can be collected from that, and these are smeared on a glass slide and immediately put into 95% isopropyl alcohol or ethyl alcohol. So the cells will get fixed to the slides. Then the other end of the spatula, I will show you the spatulas later. So we can take smears from the posterior fornix, which is the deepest area of the vagina, and from there the cells that are collected from the endometrium or from the vagina or from the cervix can be collected, and they are also smeared on another slide, and these slides are labeled with a specific number, and the name of the patient should be entered on a book along with the slide number, and the slides are fixed for about say 1 hour in that alcohol to 95% alcohol. Then what we can do is a special stain is done that is known as Papa-Nicolau stain, which takes about 1 hour by a trained technician, and the cells are screened by the experienced pathologists. Some people also give training to the technicians so that they will identify the abnormal cells and keep it to the specialist opinion of the cytopathologist. So, in the early stages, what we find is we may find some infections or some changes in the cells, which we identify as mild dysplastic cells of the cervical cells or endocervical cells, or we may find some endometrial cells. If there is a more bleeding, sometimes endometrial cells also can be identified. So there are stages like mild dysplasia, low grade dysplasia, then there is high grade dysplasia. So when we see the cells, if there is a low grade dysplasia, this doesn't matter, you follow the case and give the proper treatment for the patient. Or if there is any infection like trichomonas, candidiasis, these patients also can be treated. And sometimes we come across bacterial vaginosis, that also can be treated for both the husband and the wife. But if we find high grade dysplasia, the patient should be followed, and if necessary, a biopsy can be done. And if it indicates that the patient is in a almost pre-malignant condition, if the patient has passed through the childbirth, and then only we advise hysterectomy. Not panhysterectomy, but only hysterectomy will be advised. So we don't advise removal of the ovaries or anything. I will show you the images later. Okay. So we are the time taken from the mild dysplasia of the cervix to the invasive carcinoma is nearly 10 years. So if there is any abnormality found in these smears, the patients should be advised to follow every 6 months. If there is any abnormality, every 6 months they should be followed. If there is a doubt of HPV virus, human papilloma virus infection in the cells, then also the patient should be followed. And only when there is no response, it is better to advise them hysterectomy and prevent carcinoma, invasive carcinoma of the cervix. So we have 10 years time to prevent the carcinoma of the cervix in women, which is very, very important in the present days, because everyone wants to live a healthy life, and we should explain to the women, particularly educated people, they will understand, but the village people, if they don't have any complaint, even if we conduct camps, they won't come. So such people should be, particularly, they should be impressed, explained, and we should see that they are regularly screened, and those women should be rescued with our screening programs. Later I will show you the photos so that you can understand what are the changes that can occur. So carcinoma of the cervix is one of the preventable carcinoma in the females, apart from the carcinoma of the breast. Thank you.